Hello, we're from B5 and we're going to present about our student project titled Risk Factors Association between Apolipoprotein A1, Apolipoprotein B, and Severity of Coronary Artery Disease, Evidence-Based Medical Review. And here's the group members of B5.
Hello, my name is Refferty with the last three digits of my student ID 003. This is the background of our student project. Coronary artery disease, or CAD, remains the leading cause of mortality around the world, and the risk stratification of the CAD still relies heavily on standard lipid profiles. But many patients still suffer cardiovascular events despite having normal lipid profiles. And so now modern healthcare requires more sensitive biomarkers to detect atherosclerosis risk earlier so that we can manage CAD more better. That's all for me. Next slide.
Hello, my name is Putri and my last three-digit number is 167. I will continue with the explanation of the study background. In response to the limitation, apolipoprotein A1 and apolipoprotein B have been proposed as more precise biomarkers. ApoB reflects the total number of circulating atherogenic particles, while ApoA1 together with HDLC exerts significant anti-atherogenic and vascular protective effects. These parameters are considered to be more biologically relevant to the process of atherosclerotic plaque formation than LDLC alone. Therefore, this literature review aims to evaluate the relationship between ApoA1 and ApoB and the severity of coronary artery disease, and to determine whether these markers can serve as better predictors of ischemic heart disease than traditional risk factors in order to improve future clinical risk stratification. Thank you.
Hello, my name is Ketut, Omni, Kanya, and Uttami, and my last three-digit number is 048, and this is our problem formulation and also the objectives of the student project as shown in the slides.
Hello, my name is Ishanda Kusuma with relasi digits of student ID 025. Now I will identify what type of patient of this above scenario. The scenario provides general knowledge about arteriosclerosis and coronary artery disease, encompassing established risk factor as well as emerging one. Such foundational information typically aligns with what is asked in background question. Subsequently, the researchers in the scenario aim to determine the association between this risk factor and the severity of coronary artery disease, and whether these parameters serve as superior predictor for ischemic heart disease. This type of inquiry is specific and focused on exposure outcome relationship and clinical prediction, thereby classifying it as a foreground question. Based on the aim of the scenario, the type of question that need to be assessed is a prognosis or risk factor question, as the researchers seek to evaluate how specific exposure or biomarker influence the likelihood, progression, and severity of a disease. Thank you, and next slide.
Hello, my name is Nesa Aini with last digits number 156, so I will explain about the clinical research question using PICO. So PICO stands for Population Intervention or Exposure, Comparison and Outcome. And the population is adults diagnosed with coronary artery disease or suspected ischemic heart disease. And the intervention is the measurement of ApoA1 and ApoB as novel cardiovascular risk markers. And the comparison is traditional lipid parameters, particularly HDL cholesterol, and the outcome is prediction of CAD severity, for example given like angiographic severity scores and risk of ischemic heart disease. That's all from me. Thank you.
My name is Nadya Ernestine with the last digits of my student number are 155. So how can the clinical research question can be formulated based on the scenario? Based on the scenario described, the following clinical research question can be formulated. In adults with confirmed or suspected coronary artery disease, do apolipoprotein A1 or ApoA1 and apolipoprotein B or ApoB provide a stronger predictive value for CAD severity and risk of ischemic heart disease compared to traditional lipid markers such as HDL cholesterol? That's all from me. Thank you.
Hello, my name is Natasya Pramatya Putri with Raya student number 111. I will explain about how do we find the best evidence to answer a clinical research question. So to address a clinical research question, a journal article search was conducted using the PubMed advanced search feature, and the keywords used were coronary artery disease or ischemic heart disease and HDL and ApoA1, and several filters were applied to identify the most relevant articles. Only meta-analysis or systematic reviews published within the last 5 years were selected for the inclusion. And the search using the selected keywords identified 1316 articles. However, only 4 articles met the clinical research question and eligibility criteria. The article selected for use was the association between apolipoprotein A1 plasma level and premature coronary artery disease, published in 2021. This article aimed to evaluate the association between apolipoprotein A1 and premature coronary artery disease. A total of 17 case control studies fulfilled the inclusion criteria and were included in the analysis. Plasma ApoA1 level were significantly lower in the patient with PCAD compared to the controls. Based on this finding, there is a significant association between low serum of ApoA1 levels and the occurrence of premature CAD.
Hello, I'm Mario with student number 123, and I will be discussing about how to apply the critical appraisal, especially in this case. So there are basically 3 aspects, which is validity, which is to see if whether or not the study is valid or not. And the second one is importance. Is it medically important? Or the applicability, which means that is it applicable to our patients, especially in Indonesia, and also it does not cause any kinds of controversies, and it is applicable especially to the patient and also to the family. So based on this study, we can see that it is pretty valid with a clear pico structure, that is to see the association with ApoA1 levels, associations with CAD risk, early CAD risk, and a carefully chosen method to search the databases, although it lacks on comprehensive core studies, but it is carefully selected to be reviewed. Especially, there are 4 main databases that is uh, have many journals. And the second one, it is also important because the finding shows consistent findings, which is a strong association with early CAD findings and significant statistical analysis. And it's medically important to note that ApoA1 levels can be an important biomarker to detect early CAD risk. And it is also applicable as long as the demographic is similar to the definition of early CAD risk, which is uh, younger than 65 on men and younger than 55 on women. But it is also applicable since it is a non-invasive laboratory findings that can support a lot of things, especially to detect it very early. That's all from me.
Hello, Doctor. I'm Michael Jonathan Raya with 3 last digit student ID number 182. And now I'm going to talk about critical appraisal, journal quality, and meaning. So, overall, the meta analysis used good methods like a broad database search, clear criteria, and appropriate statistical tests. But the problem is in the quality of the included studies. All 17 studies were rated fair or poor based on the NHLBI tool. Most lacked sample size justification, random sampling, blinding, and proper control over confounding. This also explains the high heterogeneity. What this means is that although the meta-analysis found a significant association between low ApoA1 and premature coronary artery disease, the certainty of this evidence is still low. The findings show correlation, not causation, and the association was only strong in developed countries, so it may not apply everywhere. So the conclusion is that the evidence is useful but should be interpreted with caution, and better designed cohort studies are still needed before ApoA1 can be used confidently as a predictor in clinical practice. And that's it. Thank you.
I will continue the presentation. Before that, my name is Prema Pradnya Prashanti with the last three digits of my student number are 064. I will explain about integration of research result with the clinical expertise. The meta-analysis showed that decreased apolipoprotein A1 levels were significantly associated with the occurrence of premature coronary artery disease. However, integrating this result with clinical expertise in daily practice should be done with caution due to the limitation of the study. The study limitation is all studies analyzed in this meta-analysis use only case control design. No prospective cohort studies were analyzed, resulting in a low level of evidence. Therefore, further studies with good quality prospective cohort designs are needed to confirm the association between apolipoprotein A1 levels and premature coronary artery disease. A significant association was only found in developed countries, while in developing countries it was not significant. Therefore, apolipoprotein A1 cannot yet be used as the primary biomarker for predicting premature coronary artery disease risks in developing countries. In assessing coronary artery disease risks, it is important to continue monitoring standard lipid profiles and identifying risk factors such as smoking, diabetes, and family history. Meanwhile, apolipoprotein A1 levels can still be monitored in this risk assessment. Okay, that's all from me. Thank you.
My name is Gede with last three digits student registration number of 100. The meta-analysis links lower APOA1 levels to PCAD, but reliability is limited by the lack of prospective cohort studies. The association is significant in developed countries but not significant in developing countries. In developing nations, testing offers limited diagnostic value and may not justify the financial cost or resource allocation. APOA1 should not replace the assessment of widely known risk factors such as smoking or diabetes. Testing is reserved for patients who explicitly value an exhaustive investigation and understand the low certainty of the current evidence.
Let me introduce myself. I am Haqi Hudaya with the last three digits of student register number 093. Our conclusion of our student project is research question are foreground question focusing on whether apolipoprotein A1 or apolipoprotein B provide better prediction value for GAD and EHD compared to the traditional lipid marker. A PubMed research identified over 1,300 articles and one relevant meta-analysis from 2021 was selected. The study showed that low apolipoprotein A1 is associated with premature CAD, but the evidence is limited due to the very poor study quality and high heterogeneity. The association was significant mainly in developed countries, so its applicability in developing region is limited. Therefore, apolipoprotein A1 may be used as additional biomarker, but not conventional risk factor should be remain the primary basis for cardiovascular risk assessment. Thank you. That's all our student project presentation. Thank you.